I'm Rani Morrison. I'm Senior Director, Care Continuum at UI Health. We started with patient ping a few months ago, and we use the pings product for our care coordination team that are following our high-risk patients, and they receive alerts about their patients so that they can then follow up with them quickly when they're discharged from another entity in an emergency department, or when they understand that they have been admitted to a subacute or skilled nursing facility. Within the hospital, we also use the stories product quite a bit. We've deployed it in our emergency room with our emergency room transition coordinators. They have access to it so they can view the patient's story before they meet with them to discuss, again, engaging in primary care and their follow-up appointments, and understand a little bit more about that patient's actual story in terms of where they've been for care, where they're comfortable, and what's been addressed in the past. It's given us great insight that we hadn't had before with the absence of this type of product, and it's helping us get an idea of what they understand about the care that they've already received, in order to better educate them and hopefully improve their care with this more kind of collaborative approach. So we did have a patient recently that was admitted to our hospital. It wasn't from the immediate area, it was from a suburb that was quite a bit away. We couldn't quite figure out how the patient ended up at our particular facility. And so we were able to go into patient ping and look at his story and understand previous hospitals he'd been to. And actually he was assigned to an FQHC. So we were able to actually follow up with this FQHC care coordinator and let them know he was in our hospital and collaborate with them about how we could come up with an appropriate post-acute plan for him, considering his limited resources, lack of insurance, and other things that were limiting his ability to access care. And I think that's a really good example of how we can use this information and identify creative ways to collaborate with different providers to address the needs of these patients, especially those that are accessing the hospitals and health systems, SNF, SAR, the FQHCs very frequently.